Hi, welcome back to Job Opportunity, and today we have Dr. Patrick Lay, who is a physical therapist and owner of Premier Physical Therapy. Mr. Lay, how are you today?
I'm doing great. No, thanks for having me today.
Yep. Today we are asking him a few questions about his job as a physical therapist and a business owner. To start off, can you briefly explain your profession as a PT and a business owner?
Yeah, well, I've been practicing for 20 years in outpatient orthopedics. Specifically, that's my field of expertise. Just kind of give you a brief kind of introduction in outpatient orthopedics. My role is to assess patients' musculoskeletal issues that can include strength deficits, joint mobility deficits, for example, in the shoulder or the knee, and overall how that relates to their function or lack of function.
And as that type of physical therapy, what kind of patients do you see in your practice?
Good question. So in our practice, we see the spectrum of patients. We primarily do cervical lumbar spine. I think that's what you kind of find in the general population of folks out here, but we see patients with ankle injuries from sprains to knee replacements, joint replacements, shoulder replacements, those type of things. We'll see carpal tunnel surgeries, wrist injuries, you name it. We have probably seen everything. We even treat some spinal cord injuries, people with some higher level neurological deficits like Parkinson's, for example.
And as a physical therapist, I know you guys have more of a long-term relationship with your patients. What differs, I guess, your relationship between you and the patient, and then a family doctor and a patient?
Mm-hmm. Well, we have the luxury of spending, like you said, a lot of time with patients. Typically, we may see patients 6 visits. Sometimes if it's a chronic issue or a long-term surgical issue like multi-level decompression, we'll see those patients for 2-3 months. It may be once, twice, 3 times a week, depending how they're doing, but you learn, they become almost like a pseudo family. You learn about their kids, what they do for a job. We spend an hour with them every visit. So in that sense, we really get to know the patient close. Unlike physicians, family practice, they are limited on time. They may have 5-10 minutes. Their physician assistant may be seeing them, and they really don't get to connect with the patient. And that we're lucky to do that, and that really helps with the healing process.
And you said something about how you treat them as family. Would you describe like your coworkers as well, as you treat them like family, and you're just all like in that family?
Yeah, my staff, they've been with us, me and my wife too, for many years. So I've seen their kids grow up, from newborns to going to elementary school up to middle school. So we have long-term relationships with them, and folks like that, because there's no turnover. They're not coming on 2 months later for another problem, like, oh, who's this gentleman, who's this lady? So in that sense, they feel like, hey, I'm coming back to the family again. They're going to take care of me, they're going to treat me, and that really helps with patient satisfaction.
And how long did it take for you to really just grow your career in the beginning?
Well, as you come out as a new graduate, obviously you're at the bottom of the barrel. I worked at a couple of companies, aquatic rehab facility, another outpatient orthopedic facility. And just over the years, you're learning from other practitioners, other therapists. You need some hand-holding, some guiding early on, but as you become more independent, you're working with more patients, you're seeing real life patients, you're taking continuing education courses, you become more comfortable, and become, an expertise, if you will, in your field.
And when did you decide to open your own practice?
Well, coming out of school, I've always thought about opening your own practice, but that is a challenge out of school, because when you have school debt, you're looking just to make some money to pay off the school debt, and just to, again, gaining some knowledge and some more information into your early career. So, I did not open the practice until 2009, and that was 9 years after I graduated. Now I've been practicing as a practitioner at my own clinic for 11-12 years now.
So what is the difference, do you think, in your in your work schedule between a practice of your own and someone else's practice that you have to work for?
Well, I mean, as a practitioner and owner, you're not clocking in, clocking out. There's always things you have to worry about. Before I was an owner, you clock in, treat patients, you clock out. Now I have to worry about my staff, their hours, wages, salary, health insurance issues, and then most importantly, unfortunately, dealing with the medical insurance side of it. That's getting authorizations, medical necessity reviews, doing peer-to-peer reviews. So there's a lot more work and stress as a business owner versus just a employee, if you will, and just clocking in, clocking out.
And what is a ordinary day look like for you? Just like go through your schedule, go through that.
Yeah, I mean, I'm a business owner, but I still treat. Some business owners will be less hands-off and maybe treat 20 hours a week. I'm there 40 hours a week, 5 days a week, and treating alongside my other staff. So I'm trying to balance the ownership of the practice, but in a given day, between our staff, we may see 15, 20 patients in a day. Our hours are 3 10-hour days and 2 5-hour days, so we have some balance between that. But again, I'm out there, I'm treating, not taking any time off, so it keeps me quite busy.
And what is one thing that you just really love about being a physical therapist?
Well, one, again, like I talked about earlier, is developing relationships with patients. Once they're discharged, we know patients that we actually will continue a relationship with them on a friend level, meeting out, playing golf, having dinner with them. Two is I see something different every day. This patient may come in with the same diagnosis, but everyone is so different. Everyone's function is different, everyone's goals are different. So no patient is the same. And obviously seeing someone get better is a good feeling. They may come in unable to walk and they ambulate 5 feet. By the time they're done therapy, they may be ambulating, walking 500 feet. Just little things like that, where I can do my dishes. I can go play with my grandchildren. I can golf again. So seeing people achieve their goals and having a reduced or pain-free lifestyle is great to see. And I've been doing this for 20 years and it hasn't changed.
And what is one thing that you would tell others that are aspiring to be in the same field as you?
Well, it's certainly a great field. It's certainly rewarding. There is high demand for physical therapy. We have students that come in and they always ask me that question, would you do it again? I would. I do tell them this day and age is a little more cost prohibitive because a lot of the schools, it's a 3-year doctorate program. So just to look at the financial aspects of it, how much you may owe afterwards. I don't want them to deter them from not going to PT school based on finances, but that's something they need to look at because they may come out owing, $150,000, $200,000 in school loans. So again, living in California, of course, is very cost prohibitive or something. So besides that, I tell all the students, definitely it's a great career. There won't be a time where you won't have a job. They can't outsource this. They can't mechanize this. You need people, you need hands-on. So in that sense, it's job security forever.
Yeah, I've talked to a lot of doctors. They all say, wait till the end. It's delayed gratification, and in the end, you'll have a very good time. But thank you for your time today, Mr. Lay. Any last words for those high schoolers out there who need an idea on what to pursue in life?
Yeah, well, the best thing is to go experience it. That means volunteer, check out the environment, if that's in finance and medical, food service, whatever it is, but you want to make sure it's something you have a passion for. So if you don't have a passion for it, going to work every day could be a little dull. So if you're passionate, you enjoy what you're doing, it's not really a job, the day goes by quick. So that's what I would say to you guys.